Today we're going to go over some examples of facelift surgery and what sort of the thought process is, as well as some of the reconstructive considerations in facelift surgery. So this is a patient of mine who has a few different things going on. I would say the biggest thing that I notice in her is fat atrophy. So this malar fat pad, which is this triangle area right here, has completely lost its fat and it's descended down, which is creating a bit of a deepened nasolabial fold, and that gravity is pulling down and creating a bit of a jowl. And so in order to reconstruct this, one of the major things we need to do is reposition the malar fat pad and then borrow some fat from the abdomen, fat graft, and transfer that fat into the cheek area. So once this is lifted up, it will provide support for the face, and that will allow us to address both this cheek as well as the nasolabial folds and the jawline. At the same time, she has deep wrinkles and she has a lot of loose extra skin. And so for that reason, we need to do a full deep plane face and neck lift in order to reposition the muscle up and reposition the skin back and up. And that will allow us to smooth out the lower jawline, remove some of these deeper wrinkles, as well as reconstruct the loss of fat that's occurred in the face over time. So if you have a look at her after picture, you can see that here. So the cheeks are now higher, rounder, and have more fat in them, which is a bit of a more youthful position. But the other important thing about restoring the fat is you see that the nasolabial fold has improved and the jawline has found support for a longer lasting result by allowing that malar fat pad to suspend the face upwards. At the same time, our face and neck lift has removed some of the excess skin and reduced a lot of the kind of extra deeper wrinkles in the face. For some of the finer wrinkles, the patient has done CO2 laser around the mouth. And overall, that gives her a very nice result.